It is being called a groundbreaking advance in medicine. High-intensity focused ultrasound, or HIFU, offers incision-free brain surgery. Hartford HealthCare using this very innovative technology to deliver life-changing results for patients. Joining us this morning to tell us more about it, Dr. Joseph Wagner, Chair of Urology at Hartford Hospital and Director of Robotic Surgery at Hartford HealthCare. Doctor, great seeing you again. Let me start right here. Can you tell us what this high-intensity focused ultrasound actually is and why is it so groundbreaking?
So high-frequency ultrasound is different than low-frequency ultrasound. That's the ultrasound that we use for imaging. So for instance, we might follow a patient's pregnancy, look at a gallbladder, etc. High-frequency ultrasound heats up tissue and can kill that tissue, and we can use it to treat prostate cancer. As you mentioned, we also use it for brain lesions. It has a number of very good applications in the medical field.
Doctor, that being said, who is the best candidate for this type of treatment?
So for prostate cancer, we're really looking for patients that have low or intermediate risk prostate cancer on one side of the prostate. That tends to be about 15% of the patients that present to us with prostate cancer. Other patients may be a better candidate for active surveillance, just keeping an eye on the cancer, radiation, or surgery. But roughly 15% of the patients are good candidates for this.
Doctor, what are the benefits of this treatment and are there any downsides out there?
Yeah, so there's certainly downsides with any kind of treatments, even active surveillance for prostate cancer. But there's a very good study in European Urology recently. That's the best urology journal in the world. And they took thousands of patients with low and intermediate risk prostate cancer. Half got surgery, half got the high frequency ultrasound. Equal number of men cured at 3 years with less side effects with the high frequency ultrasound because you're only treating part of the prostate. So there's less impotence and incontinence, but those are still risks with treatment.
Doctor, what can patients expect when they're receiving this kind of treatment?
So it's an outpatient procedure. They come to our surgery center, have the procedure performed. There's a catheter in their bladder for 1 week afterwards to drain the urine while the prostate is swollen. We take the catheter out, and then the vast majority of men do fine. The main complication in the short run is urinary retention, men having problems urinating afterwards due to the swelling.
So after this procedure, can men as a rule get back to their lives before this procedure completely?
Absolutely. Once the catheters comes out, they have absolutely no restrictions.
All right, Dr. Wagner, we appreciate your time this morning and congratulations with this new treatment option.
Thank you for having me.
All right, we're back with more of Good Morning Connecticut.